Thank you for yielding. I really thank you for bringing this important topic to the floor tonight. Look, we're 6 months and 6 days away from the full-on implementation of the Affordable Care Act. We're 3 months and 6 days away from the open enrollment period, October 1st. You can't help but feel it's like a fast-moving train charging down the tracks, moving toward a head-on collision with the American economy. And it's going to be the small business that suffers the devastating effects of that head-on collision. We've had opportunities to talk to the people from the agencies to the extent that they will. I'm worried. I don't see how they can have that federal hub up and running by October 1st and have it work the way it's intended the very first time, especially if they don't have time to test it before they turn it loose on the American people. Very worried about what the world is going to look like after January 1st. I got to tell you, from the standpoint of a practicing physician in a small practice, we had 5 doctors in my practice. I can just tell you, well, look, remember when Part D came? Well, maybe you don't. I was here January 1st of 2006. It was rough for the first several weeks. But there we're talking about the prescription drug benefit for seniors on Medicare, maybe 42, 45 million people out of 310 million people, and just talking about the prescription drug benefit, and that was difficult to implement. There were pharmacists all over the country that basically did not get paid for the prescriptions that they filled for a month to 6 weeks. Now, they were able to keep going because they had other prescriptions, they had other business going on in their pharmacies. But this is going to be everything, from tonsillectomies to childhood vaccinations to ER visits. If cash flow is disrupted even for just a few weeks, the small businesses which are medical practices in this country will have a very, very difficult time enduring. But more importantly, and you all have correctly addressed it, it's the 29ers and 49ers in this country. The people who are scared to add one more than 49 people to their employment rolls, or the people who have had their hours now to 29 hours a week so that they will not require a health care benefit. It wasn't the way it was supposed to work. The gentleman from Kentucky nailed it right off. The people of America in 2009 were saying to us, whatever you do, don't mess up the system that's working for 65 or 70% of us. The other thing they said was, if you're going to do anything at all, please help us with cost. And what have we done? Exactly the opposite. We've messed up the entire system, and it's becoming more and more apparent every day. And if you don't believe me, wait till a year from now. Wait till 16 months from now, and just see how bad it is. But the other thing is, we didn't do anything to help with cost. If anything, we've made it worse by ratcheting up the demand side, not increasing the number of providers. We've guaranteed that prices are going to go up, not just next year and not just the year after that, but for every foreseeable year in the future. And I know that's hard for people to estimate. I know the Congressional Budget Office can't give us a figure on that. But, you know, just do the arithmetic yourself in your head on the back of an envelope, and you'll be able to see that we are headed for a significant disaster. Now, it's all well and good for me to criticize the administration and the way they've implemented this, but I got to ask, where are our Democratic colleagues? Where are the solutions that they're offering? Clearly, we should do something to help the small business who is having to restrict the employment hours to 29 a week. Surely we should do something to help that. Where are the solutions from the other side? They're non-viz. They're non-existent. We should do something to help that small employer who wants to grow beyond 49 employees but is now frightened to do so. Where are our Democratic counterparts? Where are the people from the agencies coming to our committee talking to us about how this might be managed or maintained? Why aren't they talking to us about their contingency plans? You know they've got them. You know they're over there at the Department of Health and Human Services right now talking about, what if the federal hub doesn't work? What if it doesn't work the way as intended? We'll have to have a way of narrowing the scope, of confining the number of people we bring into this new Obamacare environment. But they won't talk to us about that. The Democrats won't come forward with any solution. We're doing what we can to bring people's attention to this very important topic. Yeah, to some it may be complaining, but if you don't think about it, you can't prepare. And if you're not prepared, it is the unprepared person who is really going to suffer in this new environment that, again, is created in 6 months and 6 days. I do thank the gentlelady for bringing this topic to the floor tonight. I think it is important that we continue to talk about it. We continue to talk about our ideas and our solutions, and there are many out there. And people need to assess for themselves, how will I be best served in this new environment that's brought by the administration? Or perhaps is it not too late? Or perhaps there's some things we could do to alter that course, to move it off of that center of destruction where it's aimed right now.